When I talk to my patients who are in their 50s, 60s, 70s, and beyond, there is one thing I always remind them gently but firmly. Your body whispers long before it ever screams. And when it comes to lung cancer, the kind that grows slowly, quietly, and almost politely in the beginning, those whispers are often so subtle that even smart, intuitive people ignore them. Today, I want to share something that I truly believe can save lives. The silent signs of lung cancer that seniors 50 and older should never, ever brush off. Not because I want to scare you, but because I want to empower you. I've seen too many lives changed, too many families shaken, simply because the early clues were mistaken for aging, allergies, or just normal life. You deserve clarity. You deserve to understand your own body, and to have the confidence to act when something feels off. Let me tell you something from my own experience as a doctor who has practiced medicine for over 25 years. Lung cancer rarely starts with the dramatic coughing up blood moment you see in movies. That's Hollywood. Real life is quieter. In real life, early lung cancer often looks like a tired morning that doesn't improve, a lingering cough that becomes part of the background noise of your day, or a discomfort you shrug off because you don't want to bother anyone. I've had patients tell me, "Doc, I didn't want to overthink it, or I thought it was just the weather." And yet, when we caught their cancer early, sometimes completely by accident, that small decision to get checked made the difference between life and death. So, today, I'm asking you to listen closely, because what you learn here could be the single most important health lesson you take with you this year. There's something about being over 50 that changes how we interpret symptoms. We automatically assume everything is aging. We tell ourselves that a little fatigue is normal, shortness of breath is normal, aches are normal. The problem is, lung cancer knows you think that way and it hides behind those excuses. One of the most common early signs is a cough that lingers for more than a few weeks. Now, I'm not talking about the kind of cough that comes with a cold or the flu. I'm talking about that low, lingering cough that feels like it lives deep in your chest. Sometimes it's dry, sometimes it's slightly productive, but what makes it suspicious is that it doesn't go away. You find yourself clearing your throat every morning or coughing a few times every night before bed, and because it's mild, you ignore it. But your lungs never ignore anything. They record every change. So if you've had a cough for more than 3 or 4 weeks, even if it's gentle, pay attention to it. That's your body whispering. Another silent sign that most seniors dismiss is subtle shortness of breath. People tell me all the time, "Doc, I'm just getting older," or "I'm out of shape," or "I need to walk more." But here's the truth. If walking across a room, climbing one flight of stairs, or carrying groceries suddenly feels harder than it did a year ago, that is not just age. The lungs are incredibly good at compensating for small problems, which means that when you feel breathless from light activity, something has already changed inside. Sometimes it's fluid building around the lungs. Sometimes it's a tumor blocking part of the airway. Sometimes it's irritation of the lung tissue itself. None of these things are visible when you look in the mirror, but you feel them quietly, subtly, consistently. And consistency matters. When something new stays with you, that's when you act. Now there's another sign that people over 50 always overlook. Chest discomfort that does not feel like pain. I'm not talking about sharp stabbing pain. I'm talking about a pressure, a heaviness, a slight ache in the back, the shoulder, or even under the ribs. Lung cancer can irritate nerves in unusual patterns, and because these nerves wrap around your chest wall, your brain sometimes interprets the pain incorrectly. So the ache you feel in your upper back could actually be coming from your lungs. Many of my patients said the same sentence before they were diagnosed. "Doc, I thought it was just a muscle strain. If your discomfort goes away with rest, stretching, massage, or heat, it's probably not concerning. But if it lingers for weeks, especially if it's new or slowly getting worse, pay attention. You know your body. And your body always tells the truth." Another silent sign is fatigue. Not the kind that comes from a long day, but the kind that makes you feel like you are walking through sand. A lot of seniors think, "Well, I'm older. I should be tired." But age-related fatigue does not appear suddenly. Cancer-related fatigue often feels heavier, quieter, more persistent. It shows up first thing in the morning and follows you all day like a shadow. You may find yourself needing a nap more often, waking up unrefreshed, or losing motivation to do things you used to enjoy. The reason behind this is simple. Cancer cells use a tremendous amount of energy. They steal oxygen, nutrients, and iron from your body. They trigger inflammation. All of this leaves you feeling drained long before anything shows up on a scan. So if your fatigue is new, unexplained, or significantly different from what you felt a year or two ago, it deserves attention. Then there's a symptom that many seniors find embarrassing to talk about: slight changes in your voice. Early lung cancer can press against the nerve that controls your vocal cords, which can make your voice sound a little hoarse or raspy. You may find yourself clearing your throat more often. You might notice that your voice gets tired when you talk. You may feel like you're losing volume or projection. And here's the tricky part. This change is extremely subtle at first. Many people blame allergies, dry air, or acid reflux. If your voice changes and stays changed, that's something you should bring to your doctor's attention. Early cancers near the upper lung area can affect the recurrent laryngeal nerve, and identifying that sooner rather than later can dramatically change outcomes. One of the most surprising silent signs is unintentional weight loss. And I know many seniors joke, "I wish I could lose weight without trying." But in the medical world, weight loss without effort is a red flag. Cancer speeds up your metabolism, increases inflammation, and consumes calories at a rapid rate. So if you're eating normally, but your clothes are getting looser, your belt fits differently, or the scale drops by more than 5 pounds in a month or two, it's worth checking out. Weight loss is not the first symptom of lung cancer, but it is often a sign that appears earlier than expected. Listen to it. Another whisper your body gives you is frequent respiratory infections. If you suddenly catch bronchitis 3 times in a year, or your pneumonia keeps coming back on the same side of the chest, that is not normal for someone over 50 who previously had a healthy respiratory history. When a tumor blocks part of the airway, mucus gets trapped behind it. That creates a perfect environment for bacteria to grow. So what looks like just another infection could actually be your lungs struggling to do their job. If you're using antibiotics more often than usual, or if your cough keeps coming back after every treatment, take it seriously. I want to make something very clear. Having one of these symptoms does not mean you have lung cancer. Aging, allergies, asthma, infections, acid reflux, and even stress can mimic all of these signs. But here's the key difference. Lung cancer symptoms persist. They stay. They linger. They don't follow the pattern your body is used to. That's why noticing these quiet early changes is so powerful. Finding lung cancer early can mean the difference between a simple surgery and a life-threatening emergency. And modern medicine has never been better at treating early-stage lung cancer than it is today. Now, here's where your action comes in. I'm not just sharing this information so you'll worry. I'm sharing it so you'll act. If even one of these symptoms sounds familiar to you, don't wait weeks or months hoping it goes away. Talk to your doctor. Ask for a lung check. Ask about a low CT scan if you're a current smoker, former smoker, or someone with risk factors. A low CT scan can detect lung cancer years before an X-ray ever could. It's quick, it's painless, and it saves thousands of lives every single year. And while you're paying attention to your symptoms, there are small natural habits that can help protect your lungs every day. Staying hydrated thins mucus and helps your lungs filter toxins more efficiently. Walking improves lung expansion and oxygen flow. Eating antioxidant-rich foods, berries, leafy greens, tomatoes reduces inflammation in lung tissue. Even something as simple as opening your windows for 10 minutes a day can reduce indoor air pollutants that irritate your lungs. These small actions don't replace medical care, but they support your body in the fight you may not even know you're facing. Before I end this conversation, I want you to remember something deeply important. Ignoring symptoms never protects you. Knowing your body and responding to its signals is one of the greatest acts of self-respect you can offer yourself at this stage of life. You've lived too long, fought too hard, and learn too much to let silence steal your health. And if this message resonates with you, even a little, take one small step today. Change one small habit. Check one symptom. Make one appointment. You're not doing it out of fear. You're doing it out of wisdom. And wisdom is what keeps us alive.